Hello, everyone, and welcome to a webinar highlighting lessons organizational leaders have learned in the pivot to supporting staff who are working remotely. We are coming to you on behalf of the Best Starts for Kids initiative from King County, Washington. I am Roxanne Lyons, principal of RHL Consulting, and I believe the way to create a just world is by listening to the voices of those most impacted by our systems. Joining me today are two leaders who work with organizations that do just that. With me are Issa Ndiaye, Executive Director of the incredible West African Community Council. Good morning, Issa.
Good morning, Roxanne.
And Cynthia Turrietta, Early Learning Program Director from Spectacular Open Arms Perinatal Services and a reflective consultant for Best Starts for Kids. Hello, Cynthia.
Hi, Roxanne. Good morning.
I'm so excited and grateful to be talking with both of you about how you're supervising staff who are working remotely. It's so important today that everyone who can does social distance. So working remotely is a really powerful and important strategy. But I'm wondering how leaders and supervisors are making that shift. We're seeing the COVID infection and complication rates disproportionately impact communities of color because of structural inequities that have led to insufficient access to healthcare. And a disproportionate number of people of color are not able to work remotely during this time. So those of us who can should social distance to take care of ourselves, but also importantly to take care of others. I do want to mention a bit about both of your organizations. Issa is with West African Community Council, who changes outcomes of West African people living in King County from more than 17 countries through legal support, family empowerment, and early childhood programs, serving more than 4,000 people each year. Issa is a talented leader as well as a successful entrepreneur. Thank you for joining us, Issa.
My pleasure.
Cynthia is with Open Arms, who addresses deep inequities in maternal and child health by providing doula and home visiting services. In King County, Native and African American babies are nearly twice as likely as white babies to die in the first month of life. So Open Arms work is incredibly important. Thank you, Cynthia, for being with us.
Thank you.
Mamadou Ndiaye is with Awa IT Solutions, which is a technology consulting firm working to support nonprofits and government agencies in King County, and is providing all of our IT support for us today. So thank you so much for being with us, Mamadou.
Thank you.
Let's dive in. We're going to be learning how Issa and Cynthia have adapted to support staff working remotely during COVID, their lessons learned and helpful strategies. So the first question is, because many people who work in nonprofits are relational and thrive when they're with others, how do you create a workforce atmosphere of engagement and genuine connection to your organization and mission while people are working separately?
Mm-hmm.
Issa, what have you done?
For us at the West African Community Council, relationship building is very important. And during this time, it's a must. It's pretty much a must for us to make sure that there's a natural bond or growing bond with our staff. And supervisors also should reassure their staff that, they are ready to assist in this crisis that requires everybody to be flexible. For instance, frequent check-ins are very important, and they should not be limited to inquiring about work. As supervisors also, we should ask our staff how their families are doing, if they are practicing self-care, so that they can mitigate the stress associated with COVID-19.
Thank you.
Sure.
Cynthia, how about at Open Arms?
Yeah, along the lines of what Issa was saying, it's definitely been really important to check in on staff, how this is really impacting them personally. Some staff members have taken on multiple roles, and that on top of being working from home. The genuine and organic connections that happen in an office have been really difficult to do remotely.
Right.
So making time to just say good morning over whatever messaging platform that you have, or reaching out and just saying, I'm thinking about you. Those kinds of things are more intentional now that we're working remotely, but really important. you want to be aware of when you're reaching out to your staff, not just because you need something, but also because you genuinely care about how they're doing and their well-being. Also just being flexible, understanding that, you know, kids are going to pop in on Zoom meetings, family members are going to walk by, and giving them a second to really balance the work from home. You know, they might have to take a second to give a kid a snack, or, you know, they might have to address, you know, it's nap time. And we know that, like on my case, I have a little one, she'll melt down. So I have to take a minute and come back. Just being receptive to that. It really goes a long way to give your staff grace and space, especially in this time. And setting up opportunities for people to connect, like virtual lunches, you know, like where it's not staff related. Those kinds of things they really are important. And my goal is to have a physically and mentally healthy staff when we start resuming in-person work.
Great, thank you. And you both describe such warm connections with your staff that you're intentionally making in a lot of different ways, which also connect to your mission. So thank you, it's really vitally important. Second question, how do you support your staff who cannot accomplish all of their work remotely due to the nature of their duties? Cynthia, do you want to talk about how you support people who can still do a part of their work?
Sure. Yeah, for us, it really has been a hybrid approach. Some of our work can be done remotely, and other things we cannot do remotely. We have had to do safe porch drop-offs. When this, at the start of all of this, we really sat down and talked about what was essential in-person work for each program. And then we worked based on the CDC and public health recommendations on how that pertains to our work and how we can continue to do that safely. I've learned that having very clear guidelines and clear policies about what you have talked to readily available to your staff is really important. So it is a lot of work on our end, but it's really helpful to provide guidance for our staff, especially right now when things aren't so clear.
Right.
Getting creative, you know, we have had, because our doula work is very, you know, relational and hands-on, we've had to virtually bring in partners to show, one of our doulas showed on a doll, like how to provide comfort measures while
that is creative.
Yeah, while the partner was doing that. Virtual labor support has also happened. Transition what you can digitally. A lot of our client paperwork wasn't digital, and this has really forced us to do that, which was an intentional thing we wanted to do, but you know, we just sped up that process.
Thank you.
The last thing I think I want is accessing your resources. There's been a lot of webinars on how to do online and remote work. And I think just giving your staff space to engage in those is really important.
Great, thank you. Issa, would you describe for us how do you handle a situation where staff cannot continue their work? And maybe you could give us an example of that.
Sure. Our strategy is to continue supporting our staff to replace their lost income. For instance, we place them on standby so they can qualify for unemployment benefits. And also we help them in the process to apply either via phone or online. And we also try our best to connect them with other resources so they can continue to feed their families. In fact, let me share one example before I tell you what I did last week on their behalf. Unfortunately, during this time, we had to close our preschool. So one example is our cook. We had to place her on standby because there's no children coming to the school to cook for. We wanted to be mindful, just making sure, you know, she had money to take home, care for her family. And this last week, I was in a call with the city of Seattle and also Employment Security Department, just advocating for my staff that applied for unemployment. And to this date, their status has been pending. So my voice, I just wanted to make sure that my voice was heard and then we could find a remedy to this so the staff gets their money and cares for their family.
Awesome. Thank you. I think about, as you described that, I think about the probably millions of extra steps each of you are having to take on behalf of your community and also your staff during this time of shifts.
Yes.
Thank you. From the perspective of the community and your client, what has shifted as you move services, which you've always done in person, to an online format? Issa, can you kick this one off for us?
Yes, to reiterate, prior to COVID-19, all of our services were done in person. And also you have to understand the nature of the community we serve, where they highly value interpersonal relationships and in-person interactions. So it was very challenging for us to tell them, first of all, we have to close our office to you for our safety and your own safety. But over time, once we start delivering, let's say, food packages and other supplies to their doorstep, they were more open to this idea of us either communicating with them virtually or not having the in-person contact.
Thank you.
Sure.
Thank you. Cynthia, how about at Open Arms?
Yeah, we really wanted to think about what was the less disruptive way to do this for our clients. We also started implementing porch drop-offs for food and basic needs, and creating some education around, like, you know, why are we social distancing, and creating that, giving that information to our clients, I think has been really helpful. And really, like, being flexible with, now our remote visits also look different because our clients they've taken on more roles. So sometimes kids run away with the phone or run away with whatever platform they're using, and knowing and just being understanding that a visit might take 3 or 4 contacts. A complete visit might take 3 or 4 contacts, and that's okay. We understand.
Great, thank you. So because you're having to move everything online, and you probably needed to set up a new set of norms for communicating. And I wonder if you could talk us through what are some of the norms that you've set up for online communication at Open Arms, so, Cynthia?
Yeah, so we, as a team, started noticing that people were working a lot more. Think, you know, are generally, like, people in this field do this because they want to, you know, they want to help the community, and they really were stepping it up. So we talked about clear guidelines of when people are accessible online, on what platforms, and we instituted a log off day where you're not expected to contact us back. You know, take care of yourself and do what you need, because we know that they're working really hard and they're trying to juggle a lot of things. We do have, like, in case of an emergency protocol. So if someone calls 3 times in a row, that means that it's an emergency, even outside of those, like, I'm on hours, that we need to pick up the phone because it's an urgent matter. And we have started using Slack as a messaging tool instead of having, like, all of the emails that come in, and that has been really helpful.
Great, thank you. How about at West African Community Council, Issa? How are you framing, or how are you setting norms for communicating online?
Sure. For us, among all the tools that we use to communicate with our staff, during this time we recommended to use Microsoft Teams. And that recommendation comes because of these reasons, that Unix software provides many features. One being, one is able to change their status from green when they are available to yellow or orange when they are away or they are busy, or to red when they are in a conference call like we are in now. So we know when to engage the communication and when not to.
And also, I think you had told me once before that you had also created a new policy to go along with this. Did the policy specifically describe communication, or was that more about working from home in general?
That policy was more like work from home in general,
Mm-hmm.
to make sure whether they have the equipment they need, they have internet, or what is needed in general to perform the work they were doing previously in the office.
Awesome. Thank
And
you.
as I said earlier, Microsoft Teams is among many avenues that we were using before, but to make the matter easy on everybody so that we are not running around just trying to see whether folks are going to send me emails or text messages. Let's have one-stop shop. And
So you're sort of funneling communications at this time.
yes,
Interesting. Thank you.
sure.
Next question. How do you frame the changes to describe the new scope of work for your staff? Issa, do you want to start with this one?
Cynthia, would you like to go first on this?
Sure. We really saw this as a public health crisis, and as contributing, and we are working in public health, right? And we want to make sure that we do what we can to flatten the curve. So, and understanding that our clients do not have equitable access to healthcare.
Right.
So really talking to our staff, this is really not intuitive to them to work remotely, that we are doing what we can to support for the health and safety of our clients and our staff, and the same thing for our clients. We want to be with them and being transparent with that, but also this is what we need to do to keep everyone safe.
Thanks, Cynthia.
Okay.
And here at the WACC, what we did was we made sure that everybody in our staff was trained and was able to indeed work from home. Prior to this, some work from home, some did not. So we wanted to make sure when we send folks to work from home, they had everything they needed and they were indeed capable and able to work from home. And also what we did also was to make sure that everybody is comfortable with the change, the flexibility, and then discuss what the nature of this change is in general.
Great. Thank you. Thank you both.
Sure.
What goals can we realistically move toward during this time? And why are these goals critical to what you're doing?
A big goal of mine is to make sure that our staff comes back in a good place. So whatever policy, whatever support we can do as an agency to provide that, to have that goal in mind, then that's what we need to do. This is really, we talk about relational work. This is a great opportunity to enhance that in our practice and really show that on all areas and all levels of the agency. We talk about the parallel process in infant mental health, and really how are we modeling how we support our supervisees, and they can provide that support, that same level of support for their clients. And it's such a beautiful continuum of relationship building. And we want to help staff prioritize what is essential. For a lot of our staff, everything is essential. So we want to make sure that we're like, do people have what they need? Basic needs, food, health, housing, diapers. What can we do to support that? And if it means extending deadlines, then we extend deadlines. Yeah, and not everything can be done right away.
Thank you.
So for us, the main question that we ask ourselves is, what is the overarching goal for the organization at this point? Is it to meet the deliverable for the funders, or to support a community that is frequently asking for assistance? And also, we do not want the call to come from supervision. And myself, I advocate for progressive supervision, meaning, checking in with the staff, asking them, what is your take on this? Can we meet halfway? What would you have done differently? How can we collaborate?
Nice. Thank you.
Sure.
So I'm wondering about how our listeners what questions they might ask themselves to help them scaffold support for their staff, because this is going to be ongoing and we're going to have to keep being nimble and flexible and continue to create and recreate innovative strategies to address the needs. What questions could listeners ask themselves to guide that support for their staff?
Sure, I can go for that. I have a few questions that I think are good for them to ask themselves or for their staff. One being, what is essential right now in supervising staff? You know, is the staff equipped to do the work that they are supposed to do at home?
Mm.
Are they setting up their staff for success, meaning providing the resources and the supervision that is needed for them to carry their mission? You know, and also asking for the staff what their thoughts are. You know, do they have the information that they need? Is there anything we as supervisors could provide to support them? Yes.
Nice, thank you.
Yeah.
Cynthia, how about from Open Arms?
Yeah, definitely echo what Issa said as well. Feedback is really important. And also asking your staff what is the most important thing to talk about right now? Because, you know, aligning your priorities, I think, is really important. And asking what are high points and what are low points, and that just leaving it really open-ended and let someone talk to you about where they're at. What are new responsibilities that staff are experiencing, not just at home, but at work? I'm sure that there's a lot new responsibilities that are being put on them. And how do you celebrate successes? Continue to do that remotely? How does that work? And how are changes communicated and how are they agreed upon now that we have this virtual platform?
Thank you. My reflection about listening to both of you is that how you'd both be amazing supervisors to work for, the nurturing and the introspection and the reflection that's obvious in the way that you talk about thinking about your staff is really powerful. In closing, what are your top 2 take-home messages if people if they have to only have 2 things that they walk away with from this webinar? What would that be?
For me, should I go ahead?
Oh, thank you. So
Sure.
I think for me is that you are doing the best that you can, and so is your staff. So being understanding and flexible about that, and that this is new, so we're learning as we go.
Thank you. Issa, how about you? Your 2
For
take.
me, one of them is it's more challenging to supervise staff remotely. Some require more hand-holding. The other one, as Cynthia mentioned, was flexibility. Our staff, we have to understand that there are workers, caregivers, cook, and everything else. So we have to be flexible as to, you know, whether they want to work the day shift, night shift, you know, swing shift. Yes, we have to be very flexible.
Wonderful. Wow. Thank you both for sharing your wisdom and your experiences with us. Thank you all for joining us from the virtual realm. Thank you, Issa from West African Community Council. So lovely you joined us. Thank you, Cynthia from Open Arms Perinatal Services. Thank you so much. Mamadou, thank you so much for joining us from AWA IT Solutions and making this all happen like magic. So this is Roxanne Lyons signing off. Thanks to all of you. Really appreciate your being with us today.
Thank you all.
Thank you. Take care.
Bye. Bye.
Bye.